just going to bring up some topics today regarding dementia and personal care. You have a loved one who's refusing to take a shower because they already took a shower. Now, you know that they haven't had a shower since last week, but they are firm in their belief that they've had a shower. How are you going to handle this? Is it going to get to a knockdown, drag out fight? Are you just going to resign to the fact that they're going to be dirty? What are your options and what are your game plans? First, let's look at the big picture. Are they visibly soiled? Is there some skin problem that they are dealing with right now that makes it so they have to be cleansed? Do they have a doctor's appointment today? Do they smell? If the answer is no to all of these, we have to decide if it's really worth the battle today. Another idea is to take a step back, drop the subject, and plan ahead next time. New outfit that you want them to try on. Suggesting that you go out to a new restaurant and everyone is going to get washed up beforehand. When it comes to their personal care, such as toileting, do you assist them with that? Something that we could maybe put soap and water, warm water on their wet wipes, and suggest we use those instead to kind of help with freshening up. So there's many alternatives than just forcing them into a shower and hosing them down. But the best advice I can give you when it comes to bathing and showering is prepare ahead of time. Have everything you need ready. Have plenty of towels. Have the room warm. Have all the shampoos, the lotions, everything. Have another change of clothes ready. Everything is ready so that when you're there, you can be 100% there. It will be just a minute, Mom. I just want to wash down your legs, just to get a good look at them. The doctor's worried about the swelling in your legs. Let me just wash them down real quick. And while you're there, you just wash everything down. Having those clothes in the warm room and the towels will help kind of alleviate most of the excuses you'll hear once you get in the bathroom. It's too cold. I don't have anything red. There's not enough towels. What if I slip and fall? Don't get my hair wet. All of that. So prepare for the statements before we get there. When all else fails, you may need to look to an outside person to assist with showers. I have some people that I have assisted with dementia who just can never accept a family member helping them in the shower. But a CNA in a scrub uniform coming in and saying, the doctor sent me, this is my job, I'm here to assist you with this bathing routine, is much easier to handle for them. Doesn't mean you're failing. It means that we are doing whatever we can to make this journey easier for them. Personal care and getting the sequences confused. Unfortunately, this is very common. It starts about middle of the early stages, that mild cognitive impairment, the beginning of their dementia. Things aren't quite going the way they should be. So we may be showering but not rinsing all the shampoo out of our hair. We may forget to use soap completely in the shower. We may be getting dressed and get dressed incorrectly, miss buttons, miss a zipper, don't put the belt through the belt loops, all the way to the point of putting our shirt on over our pant legs, putting undergarments over the pants, putting the long sleeve shirt on before the short sleeve shirt, forgetting to brush our hair, or forgetting to brush our teeth, maybe putting on some makeup or putting on makeup wrong, putting lipstick in our hair, putting eyeshadow on our lips. These are all, unfortunately, very common. We are trying to stay independent and do things on our own, but we can't make the puzzle pieces fit correctly. I would recommend simplifying our routine as much as we can. Maybe just leaving out our lipstick and not the eyeshadow and the mascara. Making things easier. When their clothes are being set them out in the order they should be. Don't just lay out some pants and shirts and underwear. Okay, have it that on the bottom is the socks, then the pants, and then the underwear. So the first thing they grab is the underwear, then the pants, then the socks. By layering it in sequence, you're not telling them what to do, but you're giving them the tools so they can do it themselves. Repeating some care routines over and over and over again. If we are used to our hair being just so, we've always brushed our hair before we left the house, or we've always put lipstick on before we left the house, that may become kind of a crutch to knowing that life is okay. I'm okay. I have my lipstick. I'm going to put my lipstick on. I'm good. Is my hair brushed? I'm going to brush my hair. Is my hair brushed? I'm going to brush my hair. We're holding on to the security of that, but we can't hold on to the memory of accomplishing that. Try to embrace it as much as you can. Say, okay, we're done with that. But accept it too that this is kind of a hurdle, and you rushing them is going to upset them, make their anxiety worse, and they could keep repeating the pattern. Is my hair brushed? Your hair is brushed. I need to brush it again. Okay, let's go to the bathroom. We'll brush your hair, and then we're going to go to the store. So we're going to the bathroom. You're going to brush your hair, then we're going to the store. Okay, you're brushing your hair. You're doing a great job brushing your hair. Now we're going to go to the store. You've brushed your hair. Now we're going to the store. I've brushed my hair. Yes, you've brushed your hair. Now we're going to the store. So now we're leaving because we've already brushed our hair. So see how I've walked us through the whole step, realizing that we're not going to remember doing it, but I've reassured them that it's been accomplished. And I've acknowledged how important that is. Your loved one is refusing to let you help them. I can do it myself. I don't need your help. I can do it myself. Will you stop treating me like a child? There's multiple reasons for this. Acknowledge that you realize they can probably do it themselves. Mom, I realize you can do it yourself, but please, will you let me help? I just want to help a little bit. One of the things I found is trying to respect their privacy, but you're worried about their safety. Making it so that the mirrors in the bathroom line up just so you can close the bathroom door almost all the way, but you look through and you can see them in the mirror. So you see what they're doing, but you're not. Where in the shower curtains just about closed, but there's a little bit, so you can kind of sneak and watch. And as long as you can, letting them have that privacy. But again, like we talked before, setting them up for success instead of failure, making sure they have everything they need before the project starts. They're going to have better success if when they're in the shower, the shampoo, the body wash, the washcloth, everything is right there. If your loved one has to leave the shower to get the shampoo, there's a better chance they're going to fall and that they're going to miss a step. So help them succeed while still trying to give them their independence and privacy. Okay? Getting lost. They get confused on where things are supposed to take place. Even in a facility or a memory care community where the bathrooms are labeled, if they're not able to put that word, bathroom, with the action of urinating, it's not going to matter. Their brain is starting to have a hard time kind of playing the matching game. So having as many hints and suggestions as possible, having a picture on the bathroom door of a toilet, having the signed bathroom are great ways. Also another great way is verbalizing your needs. Well, before we run to the store, I'm going to go pee. Do you need it? Do you need to empty the tank before we go too? You know, I'm going to go in this bathroom. This bathroom's empty if you need it. You know, before I go to bed tonight, I'm going to take a quick shower and put on some nice warm PJs. Do you have everything you need in your shower? Here, come on with me. Let's look to see if there's anything else you need before I go to bed. So I'm bringing them to their bathroom under the guise that I'm checking on something with their help. So these are all just little ways that you can assist them preparing for this personal care without saying, the bathroom is right there in case you forgot and you need to take a shower, you stink. Okay? This is a lot. This is a heavy topic. We are not going to cover every issue you're going to face with their personal care. Not in a 10-minute YouTube video, not in a 10-year YouTube video. Every day is going to have a new challenge. Please just be patient with yourself and be patient with your loved one. I know you can do this. Thank you for joining me, and I'll talk to you soon.